Hi, I'm Melissa Kersh, and I am going to present the last portion of our Crohn's disease presentation. As you've learned from Brandon and Lauren, there is no cure for Crohn's disease. There is research ongoing, and oftentimes patients and doctors face ethical issues in treating Crohn's patients. Research requires that clinical trials be done on human subjects. This is an issue ethically because the patients don't know the short-term or the long-term effects that this research will have on them or their disease process. Stem cell transplantation has been researched. One ethical issue in this is that Crohn's is not a terminal disease and so does not meet the requirement for stem cell transplantation. Also, the research that has been done on human subjects showed really no definitive answer. Some patients did go into remission. Some patients had complications from the procedures themselves, and some patients actually had negative outcomes to their disease process. So it's really unclear how stem cell transplantation affects Crohn's patients long term. Physicians are often hesitant to try risky strategies with Crohn's patients. These patients become desperate after years of dealing with symptoms and basically willing to try anything. And due to this, the physicians feel that the patients may not always be thinking clearly, and they hesitate on trying anything very risky on these patients. There are challenges to coping with Crohn's disease. It is a lifelong disease with no cure. Patients who are diagnosed often deal with depression, they feel angry, and they feel sad due to this diagnosis. The frequent flare-ups are unpredictable and can interfere with scheduled events, vacations, family life. Crohn's disease is painful and debilitating. These effects put a strain on the patient's physical and emotional health. Crohn's disease affects the patient, but it also affects the entire family. Often patients with Crohn's disease are unable to work, therefore they are unable to financially contribute to the household. This can be very frustrating for the entire family. Some patients deal with frequent hospitalizations. It's hard on the family when a family member is in and out of the hospital frequently. The frequent diarrhea can be a huge embarrassment for the patient and their family members. Pain and diarrhea interrupts family time. Often the patient will isolate themselves due to their pain and their diarrhea symptoms. Most patients will need some type of surgical intervention within the first 10 years of diagnosis. Treating Crohn's disease can be very costly. Patients oftentimes pay copays for visits to the doctor. Those copays can range from $20, $50, depending on the patient's insurance plan, and can be even higher if the patient is uninsured, up into the hundreds. Also, diagnostic testing such as blood tests, colonoscopies, and x-rays can be very costly. The first treatment course for Crohn's is typically drug therapy. These drugs can vary in cost, as low as $20 a month and can go higher into the hundreds depending on the medication. Surgical procedures and hospital stays often become the norm for patients with Crohn's disease. Top 10 problems associated with Crohn's disease. These are listed with the most severe as being first. Crohn's patients have an increased risk for developing colon cancer. They develop fistulas, bowel obstruction, ulcers, anal fissures, abdominal pain, diarrhea, depression, malnutrition, and weight loss. Plan of care for severe Crohn's complications. The risk for colon cancer does require that these patients have regular cancer screenings, and usually it is more frequent than those without Crohn's disease. They just need to consult with their physicians directly on the frequency of these screenings. Fistulas. At the first sign of a fistula, a patient needs to seek medical attention. Fistulas can be life-threatening, and they often require surgical intervention and are very difficult to heal. Bowel obstruction. Patients oftentimes will need multiple surgeries in their lifetime, so they want to weigh surgical intervention with great care. But trying to prevent bowel obstructions, they need to follow their diet. Of course, don't smoke, get regular exercise, and those things can all help to keep the flare-ups to a minimum. Ulcers. There again, to hopefully prevent the development of ulcers, follow the low residue diet that's recommended for Crohn's patients. Anal fissures. Due to the frequent diarrhea, Crohn's patients are often at risk for developing anal fissures. They need to keep the anal tissues as dry and clean as possible and treat the diarrhea as directed by their physicians. I hope you've enjoyed our presentation and learned something about Crohn's disease. Please complete our questionnaire. Thank you for watching.